What's up, team? Today I want to talk about the mobility we're doing for our lower backs. So our lower backs can be stiff for many reasons. Sitting too long, standing too long. Basically, we just don't do a lot of range of motion throughout our day except for when we work out. But that's still such a small portion of our day. It's very hard to counteract all the sitting and stationary things that we do with our bodies for work or whatever it is. Now, to go after that, in a sense, the lower back in general has a lot of things that connect to it. Your upper back, your hip flexors, your glutes, your hamstrings, all these things happen. So we're going to focus on hip mobility. And we're not just going to stretch. Our goal is to strengthen it through the range of motion we're going to put it through. I want you to think about your brain as kind of like a safety guy. He sits there, he wants to monitor things and keep you from being injured. If we find that there is a weak muscle that after we get past a certain range of motion, we're not strong in it, it's going to set up a stopping point with our nerves so that we get to that point and we're like, ooh, we can't go past it. Now, the problems can cause is if your lower back has to, for example, take on some of that range of motion that it shouldn't, but it needs to because the other muscle can't get there, that can cause some stiffness and some lower back pain. And so all the movements are going to work on strengthening in that range of motion that's bigger so that it can feel safer when it does have to go in those ranges of motion and your lower back isn't constantly having to take over its role. So the first one is a split stretch good morning. We've done good mornings in class and you've probably done them with your trainer if you have one. The idea here is we're going to get a really good stretch, but we're also going to load it with our body weight or even a dumbbell so that we strengthen it in that bigger range of motion. And then we've got the 90-90 leg sweep. That one is going to work all those little small fine muscles, the glute medius, the other external and internal rotators so that your hips feel stronger, and then as well as a little bit of a stretch in the glute maximus too, so that we're hitting a little stretch and we're strengthening, and again, giving your hips giving your brain really the confidence that your body can handle that range of motion in your hips. And the final one is really just a focus on your hip flexors. So even though our hip flexors necessarily aren't in the back of our bodies, those hip flexors, they connect to the front of your legs and they go up to where your spine is, which is where your QL is located, and it attaches in a similar area. So if they stay tight, it's going to pull on the lower back a little bit. So if we can strengthen them and again, make sure our brains are okay, like, hey, these can handle this bigger range of motion because they're stronger, then it should help alleviate some of the pressure that it puts on the lower back. So this whole part we're doing now is a mixture of stretching and using our muscles to strengthen those bigger ranges of motion. So what I would suggest doing is 12 to 15 reps of each movement 3 times in a row. So maybe you do the good morning stretch, then you go into the 90-90, and then you do the hip flexor stretch, and you repeat that 3 times. If you're short on time, 2 times will help out too. But doing it 3 times a week over a month to 2 months, you should notice quite a difference in how your lower back feels.